Joining us now to talk about a different kind of science is Dr. Shephali Wulff, Vice President of Quality and Safety for SSM Health System. Welcome, Dr. Wulff. Thank you for joining us.
Thanks for having me on.
Being a doctor is very awesome.
Thank you.
It's very tough to follow the tasting wine and traveling the world segment. But in all seriousness, everyone is at risk from the flu, especially those that are very young, pregnant women, older adults, those that suffer from chronic disease and illness. Those are especially more vulnerable. So what is the forecast this season, in the flu season? What are we looking at this year?
Yeah, so we typically take our signals from the Southern Hemisphere because influenza starts there and then migrates to the north as the climate changes. And this year, as we look at Australia, they had about 344,000 flu cases, which is similar to what they've seen in past years, about 300,000 the year before. Mostly influenza A, H3N2, a little bit of influenza B. And so that's what we expect. We expect this respiratory viral season, we should see influenza A, H3N2, plus COVID, plus RSV.
So that's how we decide what vaccinations we're going to have in our area of the world?
That starts a little bit earlier because the vaccine development has to start almost the year before the influenza season. But we do our planning in terms of, is the healthcare system ready for capacity for patients that might be sick with flu, COVID, or RSV? And so we take signals from the Southern Hemisphere to help us plan as a healthcare community for what we should expect this viral season.
So you mentioned COVID. Mm-hmm. COVID doesn't really have a season, does it?
It doesn't seem to. We're just flattening the curve from our most recent peak. There was a lot of COVID activity towards the end of the summer, maybe because people were traveling and as the kids were going back to school. And in the last couple of weeks, those numbers have declined. And we're mostly seeing right now enterovirus and rhinovirus, which are common cold viruses.
So who should be getting the flu vaccine this season? Because it's right now, it's October. That's when it starts to ramp up here.
Yep. So in the next couple of weeks would be a good time to get the flu vaccine. Anyone over the age of 6 months is eligible for the vaccine. As an infectious disease doctor, my bias is that everyone should get the flu vaccine. But you mentioned it as you started the segment. Those who are at extremes of age, those less than 5 years old, those older than 65, pregnant women, and those with chronic health conditions like COPD, lung disease, diabetes, those are folks that are at particular risk for severe influenza disease, and those are people that absolutely should be vaccinated.
Is there anybody that shouldn't?
No.
Everybody should be getting a vaccine.
They should. If you're 6 months and older, you're eligible for the vaccine. And I think most infectious disease doctors would tell you, get the vaccine.
Do you think that with the COVID vaccine and the way that people were approaching it, the divide with it, has that had an effect on the way that people are approaching the flu vaccine of, I'm not getting vaccinated anymore?
That's a good question. So as we look at our own healthcare employees who do get both COVID and flu vaccines, we still see vaccine hesitancy with COVID, less so with influenza. And then interestingly, last year there was an RSV vaccine that was approved for pregnant women to protect their babies from RSV disease. And we initially were concerned that maybe pregnant women would have some vaccine hesitancy given what we just went through with COVID. And we were wrong. Pregnant women were really excited to get this vaccine and protect their newborn babies from RSV. And so my hope is that as we get a little bit further away from the pandemic, we start to see a more reasonable conversation around vaccines and vaccine safety.
What advice do you have for people to have best practices? So, I live with some people who, I won't name names, but one of them's 7 years old, who when she gets sick, she breathes directly into my mouth.
Of course.
She likes to cuddle and breathe directly into my mouth. What are some best practices for those of us who live with people like that? What can we do to protect ourselves? What are things we should be doing? I think not breathing directly into our other people's mouths is at the top of the list.
Absolutely.
But what else can we do?
And I'm smiling. I mean, I'm also the parent of a 7-year-old, and it's impossible as a parent to not get sick when your kids are sick. But there are some practical things people can do. So, of course, getting vaccinated will not protect you from getting the virus necessarily, but it will protect you from developing severe symptoms from that virus. So getting vaccinated is helpful. Frequent hand washing is helpful, especially if you're taking care of somebody who's sick.
Right.
And then for adults and people where they can actually get tested, if you do develop symptoms of sore throat, cough, fever, get tested for flu and COVID in particular, because those are two viruses where we have treatment available.
And where should people go?
There's a number of places you can go. You can go into any urgent care clinic, any sort of quick clinics that are available through CVS or Walgreens to get tested. You can go to your doctor's office to get tested. Most ambulatory clinics where people see their primary care doctor will be able to test.
All right. Any last words?
No, I don't think so.
All right. Get vaccinated?
Yep, get vaccinated. Wash your hands.
All right. Thank you for joining us.
Of course, happy to.